Next up, we have Taylor Croft, who graduated from Macewan University. They completed a Bachelor of Arts degree with a major in psychology and a minor in philosophy. She has a specific interest in mental health and addictions advocacy with a hope to go on and complete a master's degree in counseling psychology. Here, she's discussing the effects of COVID on the tourist industry.
Hi, I'm Taylor, and I'm presenting on tourism and the pandemic. I will be discussing the ways in which tourism has been affected by the global outbreak of COVID-19, the ways in which tourism has already adapted to the pandemic, and the possible changes we can expect for travel moving forward. Finally, I will briefly touch on some of the ethical implications of travel during a pandemic. So when COVID-19 was first declared a pandemic in March of 2020, governments around the world began closing their borders to international travelers, recommending citizens abroad return to their place of residency immediately, and urging people to remain in their homes to help slow the spread of this novel virus globally. For tourism, an industry that necessarily profits from people leaving their homes, this meant economic catastrophe. The collective effort to save lives and stop the spread of the virus meant an estimated 75 million lost jobs in the tourism industry alone. Jobs not only in major cities, but also in more remote, rural, and coastal areas where many alternative employment opportunities may be minimal and the local economy relies heavily on revenue from tourism. The tourism industry was one of the first to be shut down and is expected to be one of the last to fully recover post-pandemic. Though the Canadian government, among others, is still discouraging all non-essential travel, many countries have begun to reopen their borders and consider options to reintroduce travel and tourism back into a pandemic-stricken world. The tourism industry has had to adapt quickly to find ways to mitigate the risks of traveling and reduce the spread of infection while trying to bring revenue back to these economies reliant on travel for leisure. As social distancing and reducing contact between those who may be infected with those who are uninfected is currently the top option to reduce the spread of COVID-19, many tourist attractions have had to change the way they operate in order to allow for distance between visitors. Many popular tourist spots, like museums, have begun requiring visitors to book specific time slots and have reduced the maximum amount of people allowed in any given time. Traveling to these tourist destinations remains troublesome, as airlines alone have faced their own set of challenges in attempts to keep employees and passengers safe amid the pandemic. Whereas other facets of the industry are able to adjust to allow for social distancing among travelers and tourists, most commercial airlines financially break even at a capacity of 75 to 80%. Therefore, capping flight capacity at 55 to 60% to allow for distancing between passengers is not sustainable for airlines in the long term, without nearly doubling the cost of current flight. Instead, biosafety measures like mandatory masks and temperature checks have become the new norm in airports and on aircraft. Airlines have begun urging governments to step in and regulate the process of temperature checks across all airports in order to streamline the experience of passengers and reduce confusion. Although temperature checks are not effective for screening individuals who do not present the symptom of a fever, it is one of the many ways airlines are working to detect those who are unfit to fly. Other measures deployed by certain countries include screening tests or proof of negative COVID tests within a 72-hour period. With this, it has been necessary for airlines and tourist destinations to allow more flexibility when it comes to itinerary changes. If airlines and airports are going to deny someone the right to fly, it only seems appropriate they allow easier opportunity for these same travelers to change travel plans, both now and in the future. A welcome change to a practice that commonly came with steep fees for most airlines pre-pandemic. In the thick of it all, it is difficult to predict just which of these changes made will remain in the aftermath of the pandemic, but experts agree it is inevitable that the way we travel will be changed forever post-pandemic. Travelers can more than likely expect technological changes to the way they travel. Technological elements like electronic boarding passes were already being introduced pre-pandemic, but with the current state of the world, one can expect an even greater push for these contactless options in airports and tourist hotspots. Health and safety precautions that have become commonplace in the wake of the pandemic are expected to be adapted to travel in the long term, including increased sanitation and reduced human contact. With the gradual reopening of borders, there are predicted to be systems of interlocking safe zones where small groups of countries will allow the exchanged entry of each other's citizens while still restricting access of entry from people of other countries. These will likely be between countries that have managed the outbreak of COVID-19 well, while countries that have struggled to restrict the spread will continue to face restrictions. It is also possible that certain travelers be granted more travel privileges, specifically those showing antibodies and immunity to the virus. We can also expect to see countries with strong pandemic containment to deploy these records as marketing strategies among tourists. However, there still remains ethical implications of tourism during a pandemic. Not only is there a responsibility to protect travelers, but also to protect the local populations of any destination traveled to. Many of these locations that rely on tourism for their economy and provide tourism-related jobs where other opportunities may be limited, also often lack medical systems that could support an outbreak of the virus at high volume. This is specifically true for more remote, rural, and coastal areas outside of large cities and poorer developing countries. Therefore, an ethical dilemma exists between recovering local economies reliant on tourism and protecting vulnerable populations that do not have access to a medical system that could withstand an outbreak. Moving forward, it will be a balancing act trying to recover the tourism economy while also keeping the health and safety a top priority for those at risk. Thus, destinations, attractions, and airlines must work together to demonstrate the precautions are being put in place where at all possible to minimize the risk, not only for travelers, but also local populations.
Awesome. Thank you so much, Taylor. That was a great presentation. Our next question is from Jess, and it's for Taylor. And she's wondering, what steps do you suggest airlines take to make changing flight plans easier?
So first of all, I think that flights would benefit from offering full refunds instead of just credits of any sort. I think that would give people better confidence that they're not making a risky financial situation in a time when things change so quickly and the state of the world can change so quickly and what is acceptable and what's not. And then in terms of changing flight plans, I think just as you go online or use an app to book flights, I think it would be really beneficial to be able to go online or an app and easily cancel or replan a route for a different day. People have become really accustomed to this and it's quick and easy, and I think that would make it a lot easier and give people confidence in traveling.
Okay, awesome. Thank you for that.